Dr. Kellner, I'm going to have you talk a little bit about the recovery and recurrence. That's what a big concern of patients. How long is the recovery, and how hard is it, and what's the concern of having them come back?
Sure. So, definitely very important to talk about what comes after your bunion surgery and make sure everyone understands what to expect and also set your goals. So first, looking at the healing time, kind of in a chronological order, we look at the skin incision and the soft tissues. That typically takes about 2 weeks to heal. So you'll have a follow-up in 2 weeks, and that's when the sutures will come out. And then looking at the bone procedure, if there is a bone cut or a fusion, bone healing typically takes 6 to 8 weeks overall. So it's important to give your foot that time to heal itself. And based on the bunion procedures selected will be, how long you're off of your foot. If you're doing a very simple bunionectomy, if you're like Dr. Savia mentioned, just shaving the bump off, which we don't often do, but it's possible. You can walk on it almost right away. I typically tend to wait until at least the incisions come out before I have anyone walk. But if there is a bone cut or a fusion involved, you can expect to be off the foot 4 to 6 or sometimes even 8 weeks, depending on the procedure. So that kind of covers with the non-weight bearing period as well. There are many different ways to stay off of your foot, more than just crutches. So it's also important to evaluate if there's any kind of shoulder issues for crutches. On the left image, I always mention the eye walker. That's kind of allows you to walk with a peg leg sort of assistance, and then or we often recommend a knee scooter on the right, which is very helpful and definitely easier on the shoulders and joints than using crutches. When it comes to recovery, if you are off of your foot for a long time, say it is 6 weeks of non-weight bearing, you certainly will have some weakness in that leg. Physical therapy isn't always absolutely necessary as in terms of a formal referral, but there definitely is some at-home physical therapy you'll definitely need to go through. When it comes to the procedure selected, if there's been a bone cut of the metatarsal and there wasn't any joint fusion, it's very important to keep the joints mobilized. And I'll have patients, doing at-home physical therapy, doing range of motion of their great toe joint as early as 2 weeks to make sure that there's not too much scar tissue buildup. And because the range of motion is really what helps you, walk. When we walk forward and we roll off our big toe, we need that upward motion of our big toe. In the other case, if there has been a joint fusion, the goal isn't to restore any motion, as we took the time to eliminate that painful motion and correct the deformity. So overall speaking, in terms of full return to activity, it depends on what your goals are. So it's definitely important to set those beforehand, whether you're a walker, a runner, a swimmer, biker. You can, I an average say up to 3 months for full return to activity though. They could always be a little bit quicker if you're more fortunate, or a little bit longer in terms of residual swelling and stiffness and things like that, which can of course be worked on. So
Very good. Did you want to talk a little bit? There's been a lot of questions about recurrence, and maybe we could have some of the other doctors chime in too. What's the recurrence rate? How often do they recur?
I think going by the literature, the recurrence rate is somewhere around 5%. However, I think that if the correct procedure is picked for the correct bunion, you can certainly minimize the recurrence rate. For like Dr. Savia mentioned, when you have that very severe bunion and you go ahead and chop it at the waistline, it's certainly not going to last and work out for you for life. It's if you do a more proximal fusion, as he showed in the last two cases, that's usually pretty permanent, but there is risk of recurrence, and that can happen in as early as 1 year or 5 years or 10 years, but hopefully never.
Correct. It's really important. It's really important to understand where the deformity is actually coming from. And because again, it's a joint imbalance, not just a bump of bone. In the earlier pictures, when I showed my wife's foot that had bunion surgery, she has a bunion that came back because she should have had the surgery done in a different part of her foot. Her bunion was back in about 6 or 7 years, and it's 20 something years later, and it's not quite as bad as when she first had it, but it's pretty bad. Sometimes the knee position, the hip position, somebody's posture can affect it. If somebody has a really beautiful bunion correction and they go into pointy shoes while the foot's still healing, then you can get that imbalance to come right back. So there's a number of factors why surgery would, or why bunions would return even after surgery. Sometimes they're not corrected enough. And sometimes they're corrected perfectly on the table, and then right when somebody's walking, the forces of how they walk in general, and again, like that's knee position, hip position, posture, and movement, has supreme influence over the foot. The foot is ultimately just a puppet on how the body moves over it. So if movement isn't really even and nice, then you could get a bunion back again. But the key really is fixing it at the source of where it's coming from. And Ben's x-rays sort of showed those corrections in the middle, in the midfoot, which is where those large bunions or bunions that are very flexible need to be corrected. When you go in and you have an opinion from surgery and it doesn't look like you have a very large bunion, and the surgeon says, well, we can do a surgery and you'll be in a walking boot for about 3 weeks, and then you'll be back in shoes afterwards and everything will be good in 2 to 3 months. That sounds really appealing, as opposed to, well, it's not a big bunion, but it's a very unstable foot. So let's do a surgery where you're off your feet for 2 months in a cast, and then it's going to take you a month to get back into shoes, and the recovery might be 4 to 6 months. Nobody's really going to choose that one, but that really is the better surgery for the vast majority of people. So you have to have some foresight and some planning and understand not just what's best for now, but what's best forever. And that's the discussion you have with us or your doctor, whomever you see.
So there's some great points, Dr. Feldman.